Hey everyone, I am here to do my 2-week post-op follow-up. I went to the neurologist yesterday. This time I saw the surgical doctor's nurse. So I didn't actually see the doctor who performed the surgery on me, but I did see his nurse. She looked over my incision and you can see it right there. Said it's looking pretty good, and don't be surprised, it will be a little lumpy. I don't know if you can see that, but if you touch it, it just feels bumpy. But over time, that will clear away. I'm actually really pleasantly surprised how minimal the scar is. At first, I was really worried after seeing some other pictures, especially infusions, because they have to make the incision a little larger, that mine would be big, but it's not as large as I expected. So that as well. I'm not in the collar. I mentioned that in my last video, but still nothing going on with that. At the 2-week mark, even if I was, they do say you can go ahead and stop wearing the soft collar at this point. Things that are happening and aren't happening. Things that aren't happening is there's still no nerve pain. I did go off all those meds as I had talked about before. I don't suggest this after talking with the nurse yesterday. Neurontin or any of those nerve pain killer type medications, you can have withdrawals. So I'm just letting you know that usually there is a taper involved. My method was cold turkey. I just wanted to be off. I was done, and honestly, the relief from the nerve pain was so amazing that it by far outweighed the withdrawal symptoms that I was having coming off the medication. So things that I experienced were hot and cold sweats. I would get very hot and then shaking cold within just minutes of each other. And then not so much mood swings, but I could just tell like anxiety would creep up easier. My body felt on edge easier. And I just had to make sure that I was eating right, going for walks or biking, and just keeping myself in a calm space and realizing that, realistically, this was my body coming down from abundant amount of medications, including anesthesia, so it was to be expected. So again, talk to your doctor though. Cold turkey is not the best way to go for some people, especially if you are taking the medications for a while, in a long time. I was on 600 milligrams 3 times a day of Neurontin, for those who want to know. And so that, still no pain, no meds. Sleeping, things that aren't happening. So sleep is still a little difficult. I think my body is just trying to settle back into a rhythm. After you live with that pain for so long, your sleep is just disrupted. It's almost like when you have that newborn again and you're up all night, and then after the baby starts to sleep through the night, you can't because you don't know what it's like. Same deal. My body has just not been able to have a natural circadian rhythm. So I just am working on that. So sleep is still a little disrupted, but it's not bad. It's just my mind won't relax. And if anything, I'm ready to go in the morning. I don't wake up hugely overtired or anything. And then so fitness wise, if you are active and you're looking at this 2-week mark and thinking what is that going to look like for you, you can expect to feel really good for the most part. My neck has some stiffness in it. It's muscular and it's going to be there for a while. My nurse yesterday even said that just takes a while to work itself out. Range of motion, you'll have it. Just move your head naturally is what I've kind of been told. If you look somewhere, you look. If you move, you move. But no intentional extreme range of motion stretching. And the one thing you don't want to do is lift your chin up and open up that spinal space, or the disc space, I should say, just because it is glued in there. And you don't want to be messing with the bone adhering to those new artificial discs. So try to keep your neck just very neutral and closed, but you can turn side to side and everything. I'm trying to make sure that I don't look up. So other than that, as far as my neck itself, it feels feels pretty good. Ironically, it hurts more on the right side over here, which is kind of crazy because like everything was over here before. But they pry you open, and I think my muscles are just tight back there. All right. So fitness-wise, what you can look to getting back to is things like biking on the Airdyne, assault bike. Definitely go armless and just stick with the legs. You don't want a lot of, side-to-side motion in your head. If you bring in your arms, just make sure you're keeping your head neutral. And I would really talk to your doctors and your coaches about all of this, because everybody is going to be different. There's a 10-pound weight restriction on a lot of people post-op that they put on. And again, this is a somewhat new procedure, especially 2-level artificial disc replacement. So just don't go rushing back. I know that people watching this may find that funny that I'm saying this, but it is true. Just stay humble about it. I think that is really it. I'm moving. I'm just not moving with any intensity. So it's it. No overhead, zero at all. I wouldn't even go there. That's not even a thing. No loading of the spine. Deadlifting seems attractive, but yeah, that's a no-go. So really it's just light weights, higher reps, small bodybuilding movements, and biking, and no running, just because running is so much pounding on the joints, including your spine. So even afterwards, I probably won't do a ton of running. It'll be short interval work. That is about it. I have nothing new to report. My next post-op appointment is in 4 weeks. So I will update again at the 6-week mark. But if you are heading into the surgery or looking into it, or just concerned at the 2-week mark, you are going to start to feel much better. You're going to start to head towards healing, and just stay optimistic, because the pain does get better and you will return to normal. It does exist, and those miracles are out there. So stay positive.